Good evening, everyone, and very warm welcome to the DHN Town Hall February edition. My name is Vishnu Saxena, founder and the CEO of Digital Health News and Scale Health Tech. Thank you, first of all, taking time to join us today. I know it's a busy Friday, 7 p.m. India time, and 8:30 a.m. US EST and 5:30 a.m. US PST. So it's really means a lot to have such a thoughtful group of leaders, joining here with us today. At Digital Health News, we host these town halls with a very simple intent, to create a space where some of the finest leader from India and across the world come together and have an honest, grounded conversation in terms of what's actually happening in the healthcare, not just what look good on the slides and the conversation point of view, but what really matters. How we can solve some of the problems, right? And over the last few weeks, the India AI Summit generated lots of excitement. I heard lots of big ideas, announcements, and lots of big investments. In short, the big ambitions were set, which are essential and a clear signal that now AI is now the part of India's central, agenda and the national agenda. But for the digital health leaders, a more practical question, remain unanswered. What do these AI ambitions actually mean for healthcare delivery and hospital operation, and more importantly, for the patient outcome, right? Uh, so among all the talks to adopt the AI, the reality is that the majority of our hospitals are still navigating fragmented data, uneven EMR maturity and slash HIS maturity, clinicians overload, and more importantly, the absence of IT leadership across majority of India's hospital. So this DHN town halls brings together the policymaker, the innovators, the hospital leaders, the ecosystem builders from India and the US to decode India's AI movement through the lens of digital health, and separating it from noise and focusing on the signals and the real opportunities. And this is not the recap, but more focus on how we take those ideas and translate into meaningful action that solves the problem, and we move for a better outcome, from the business and the patient outcome side. So I have a fantastic leaders joining us here today. I know all of them, in person in many years. But if I may ask all of you to introduce you briefly. So Dr. Sharma, you may go first.
Well, friends, good evening and good morning. I am Dr. R.S. Sharma, but of course, I'm not a MBBS doctor. I am a doctor of philosophy, and of course, in my numerous assignments in my career of about 45 years in the Indian Administrative Service, the last career of mine was in the health space, where I was the CEO of the National Health Authority from 2021 to 2023. And this was a critical period where we had the COVID, pandemic, and we actually I was deployed to, in a way, I was called back from my retirement to develop and design and deploy, COVID, the vaccination platform, which you may all be knowing. And thereafter, in that process, I also kind of designed and developed and rolled out the Ayushman Bharat digital mission. Of course, National Health Authority's core, area is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which provides insurance coverage of 500,000 on a family floater basis uh, for every family. Almost 540 million people are covered. In fact, now with 70 years plus all being covered universal, the number goes to 700 million. So about 70 crore people are covered, and that's the scheme which I, monitored and implemented for about 2 years from 21 to 23. So that in all, and thereafter I have been, of course, my core competence or core area of operation has been how one can use digital technologies for, governance, and of course it includes health also. Thank you very much.
Great, thank you, Dr. Sharma. Dr. Anish Chopra.
Hi, Vishnu. Nice to meet you and be with my colleagues. I served as President Obama's Chief Technology Officer, 2009 to 2012. Had the opportunity of connecting President Obama to Sam Petroda and launched the U.S.-India Open Government Dialogue, which led to the joint development of data.gov.in, which we open sourced with emphasis on distribution across the global South, and have continued my interests in healthcare IT, and was honored to be a part of the trip last week.
Excellent. Thank you, Anish. Commander Bali.
Thank you so much, Vishnu. Honored to be here amongst illuminaries around, and I am Executive Director and CEO of ClearMedi Healthcare. This is a Morgan Stanley company. It runs hospitals basically in Tier 2, Tier 3 cities, focusing on cancer. Pretty much interested in technology, truly disrupting healthcare so that the patient gets helped, removing inefficiencies from the healthcare systems. And also, I was recently in Paris for the G7 AI Summit, because France is going to be the presidency of G7 now, and they wanted some inputs on AI into the white paper that they're writing. So pretty much excited about the entire future. See a lot of things happening as we move along, some very, very fast, some not so fast. And between the doomsday scenario being projected by some, and some saying that it will not have a great impact, I'm talking about AI. I think a middle path seems to be emerging as we speak, which takes care of our apprehensions and fears, but at the same time rules out any reluctances that we want to have in adoption of AI. So very, very happy to be here today, Vishnu. Thank you so much for inviting me.
Excellent, excellent. Thank you, Commander Bali. Dr. Sujoy?
Hello, good evening, good morning, wherever you are. Sorry, I'm not able to come on a camera, going through a bereavement in the family, but I thought it was very important that I join this call. I've been working with Apollo Hospitals for about 2 decades now, in the last role for about last 8 years, where we have now 3 labs which design, develop, and deploy clinical AI solutions, and we have been, distributing it world over. Very happy to join this particular session. Was there in the India AI Summit speaking on the Elsevier panel, and it would be it would be wonderful to actually set the context and just describe what we discussed there. Thank you.
Excellent, excellent. Dr. Shibu?
Hey, hello everyone. Good evening, good afternoon, good morning. I'm Dr. Shibu Vijayan. I'm a public health professional, been in the space for almost 3 decades plus. Worked with WHO, worked with Ministry of Health, worked as a primary healthcare doctor, and now working with Cure.ai, which is a digital health company focusing on early diagnosis. We spread across India, African region, almost 100 countries, and then we do have operations in high-income markets and low-income markets. I lead the low-income market, especially the public health domain, the global health domain part. We work with the vision of early diagnosis. I'll detail out the details when we get to speak about that particular details of it. But good to have me here. Thank you.
Excellent, excellent. Thank you, Dr. Shibu. And finally, Vivek Rajagopal.
Hello, everyone. Very, very happy and privileged to be a part of this panel. So I'm Vivek. I'm the Chief of Data Intelligence and AI at Narayana Health. Have been with NH for about 15 years now. And we build and run Medha AI, which is one of the most comprehensive data intelligence and AI platforms in the country, which is deployed in Narayana Health and other hospitals beyond NH as well, in India and outside of India. I also serve on a few advisory boards on healthcare AI. Very happy to be here. Looking forward to the conversation.
Excellent, excellent. Thank you. Thank you to our all esteemed speakers. Unfortunately, Dr. Uma Nambiar and Dr. Geeta Manjunath couldn't join. Hopefully, Dr. Geeta Manjunath would be able to join in 10-15 minutes down the line. But before I start, people were saying that, hey, your panel is too big. You got 8 speaker at the Decoding India AI Summit. I said, have you seen the scale, the massive scale of India AI Summit, week-long AI dose? I got to keep it up. I can't do with the 2-3 speakers. I really need the galaxy of the speakers so that they can bring all the perspective. So this is a very thoughtful. I wanted to make sure that we have a policy perspective. Dr. Arish Sharma, Dr. Anish brings the policy perspective. Commander Bali and Dr. Uma Nambiar brings the hospital perspective. Innovation and the startup perspective, Dr. Shibu, and of course the hospital where you are implementing the AI, how it is bringing that outcome was the focus from the Vivek's point of view, and from Dr. Geeta Manjunath's point of view. So this was very, very thoughtful. And before I start, I should admit one thing, which is like a nothing short of dream coming true. So having Anish here on this panel, and having Dr. Arish Sharma in this panel, and these two giants coming together is something I always thought of, and I think the final is coming true. So Dr. Arish Sharma laid the foundation of India's, the unleashed basically the healthcare data, and created that data infrastructure, which is the foundation for any AI or any automation to actually happen. So Dr. Arish Sharma, the father of ABDM and India's healthcare data movement. And here we have Anish. Anish, in the same tone may not be the father, but if I draw the analogy, and so you unleashed the healthcare data movement in the US, right? And with the health data palooza and all, and and that was the time when I was trying to build my healthcare IT career in the US. So very honored to have these two figures particularly on this panel. So before I start, now we got to focus on the timing. We already got 15 minutes over. Let's just start with your 1 minute take in terms of what did you see, what did you take out from that India AI Summit, something that stuck with you, that believes you that this is the India's healthcare, the AI movement now. So Commander Bali, let me start with you, so everybody can take your 1 minute take in terms of what it means to you, the India AI Impact Summit.
Yeah. So one thing is becoming very, very clear, that India wants to and sort of has taken a lead where it feels that a huge amount of population like ours, and not only ours globally, can be benefited in a very, very positive manner, keeping all the negatives to one side. If we are able to leverage young talent, if you are able to leverage the scale, if you are able to leverage the technology which exists today. What also came out very, very clearly was something that I have been mentioning at many, many platforms, is 3 words of courage, conviction, and cooperation. Courage of going ahead and adopting technology, conviction that this really works and it helps the overall human race, and cooperation because everything cannot be done by you. You could have systems which are operating in a different manner, so you would want to take help from someone else. And here is where the young people, the startups across the globe, in fact, now comes into picture. And this is now coming loud and clear. So this would be my opening statement. Thank you.
Excellent. Very well. Courage, conviction. And what's the last one?
Cooperation.
Cooperation. Yeah. Amazing. Anish, you don't come to India often, and that was, very timely. And you were there, you saw it. Enlighten us. What did you see? And give us your take.
Well, I would say there were 3 main takeaways. Obviously, the PM's declaration that AI in India is not something to be feared, but to be something with the sense of fortune. That optimistic message was very pleasant to hear. The U.S. response, partnering with India towards this sort of combined kind of sovereign AI that would bring some of the U.S. infrastructure atop some of the Indian capabilities, and to take that model and replicate that not just across the global South but across the world was a key part of the broader message. But for me personally, I'm a disciple of C.K. Prahalad and the fortune at the bottom of the pyramid. Hearing much of the opportunity to the scale of ABDM and the work we're trying to do in the US on health records, it really felt like an opportunity to sort of collaborate in the development of these emerging AI in health solutions in India, and to have some of the learnings be redeployed around the world. This is a term we call it reverse innovation. We can call it Jugaad, frugal innovation. But the idea that we can address access issues to high quality healthcare through technology in areas that work in India, there'll be plenty of lessons learned that we can scale in the US. I will say, Dr. Sharma, I was on the panel with Sunil, your successor, and did see a lot of opportunity to collaborate on some of the infrastructure and enabling standards. As you know, Vishnu, both India and the US have embraced sort of the FHIR API global standards as the foundation for how information flows. I will say that it's not a direct implementation, so there's a gap that we need to close so that applications can more easily port between the two countries. But once we work through that effort, I think we'll see a great deal of opportunity. I will point out one last comment. As I understood the implementation of EBDM, a large number of the use cases initially were sort of administrative. I could get scheduled an appointment in advance and make it in scanning a QR code. That is the heart of the US health tech ecosystem that President Trump asked for in July, that will start to launch later this year. So this idea of India taking a few steps faster on the implementation of its ABDM for consumer benefit is one that I took away as well.
Super. And there's a silver lining. I love your perspective in terms of porting those applications and the FHIR being that glue. And I think this is scan and share. Dr. Sharma was, the architect of that. I think I can see Dr. Geeta Manjunath. Welcome, Dr. Geeta Manjunath. We just started. We are taking a 1-minute take of each speaker in terms of what India AI Impact Summit means. And, Dr. Sharma, to you.
Well, thank you very much. In fact, Dr. Manjunath and me met a couple of days back only in Bangalore, where I had gone to IIM Bangalore for that conference or something, where I was also speaking. Now, yeah, I think AI Summit was a very, very important sort of summit and gathering, and where we had the occasion to showcase, we had the occasion to see many of these use cases in the health space. And I must say that after finance, health was the most important, of course, part. I was there at the chair of the India Energy Stack, and there, that was my main area where I participated. But I must say that, I look at it, I look at any technology for that matter. AI is one such technology that, how much impact does it have on people's lives, or how much does it impact? Technology may be very, very sophisticated like AI is, and of course, it's a completely transformational technology to that extent. But I would say that how does it impact our people is very, very important. So I look at it three ways. One is the quality of healthcare, whether it can improve the quality of healthcare. I think yes, it can, using the power of compute power. The diagnostics, for example, will go a huge improvement in diagnostics will take place that improve the quality. Can it improve the access? Yes, it can, using the, telecommunication technologies. And again, on top of that, AI, certainly it will add access. And especially when, when the doctor and patient are communicating, and that communication can be summarized by the AI, LLMs and other things, it's a wonderful thing which will happen. Can it also improve the affordability? Yes, certainly it will improve the affordability, because things will become, as such, the communication systems are communication means the data prices are quite cheap, and therefore it's very good. But I think it will also improve the kind of affordability. So to my mind, it is going to really, become very, very important in the coming future. Number one. Number two, India has actually laid the foundation of a very democratic kind of a structure in the data interchange. And what has happened is that we have kept in mind the fact that it is the patient who is the ultimate sort of owner of his or her data. And without his or her permission, no data can, become, mobile, it can't be transferred. So if he has to share the data with somebody, it is a patient who will actually trigger. And fortunately, because of the digital identity structure in this country, which we have got, and we have got a consent artifact, which is essentially a consent token, whereby you can just fire a consent token and tell the systems that, yes, I want to share my data. This kind of, federated data architecture with a power of the patient to actually make the data available on any device or show it to the doctor and show it in a granular way is actually a wonderful sort of architecture which has been put in place. And now I think we will have a huge amount of data which, after being anonymized, can be used to kind of improve the diagnostics and improve the many other things, because ultimately AI is nothing without data. And if you have that set of data, accurate data, digital data, machine readable data, that is going to really lay the foundation of better clinical outcomes, better diagnostics, and better access. That's my sense.
Truly, 100% agree. Dr. Geeta Manjunath, what's your take? What did you see? 1 minute.
Yeah, sure. So I think one of the main things that stood out for me is the excitement in the students, excitement in the practitioners, also public, who was sort of, I was literally shocked on the first day to see that so many people wanted to listen to our panel discussion, but there's no place to get in, right, to the room. The rooms were full, no standing place. I mean, I never imagined, despite having like 10, whatever, I don't remember exactly, maybe 20 panels panelly, right? We're going to have almost every main hall so full, right? That's the main thing I saw. And of course, it because of the organizing little gaps and all, it also was the some part of it was little uncomfortable. Having said that, that's sort of the main thing that so what it shows is, of course, there's a little bit of the hype on which many of them came in. But there is more acceptance, more eagerness to learn about what's happening in the latest, aspects of different aspects of AI, etc. So that's one thing. I was on three panels actually. There again, after the panel discussion, a lot of eagerness from students and early startup founders coming in and asking sort of really kind of questions that they're grappling with, in trying to do the implementation or trying to understand how do we bring in explainability, some aspects of AI part and so on. So generally, the main thing, first thing I saw was how it enabled sort of kind of a platform for sharing of best practices from people who have done and then who want to do, right, in that category. So that's one thing. Second thing I saw was also that we were on panels together where startup founders or implementers and technologists sitting with policymakers just next door, the principal secretary, be it the head of NHA, those kind of people, right, sitting next to each other, and the questions were candid. You tell me what I can change, and and it's up to us whether we say. But so it was really a platform where we could voice out, explicitly in front of hundreds or even thousands of people in doing that. So that was very, very vivid, and that's an important aspect of progress, I would say, where I think Dr. Bali mentioned about the collaboration possible, right? And and also people making notes and saying yes. And I actually had a follow-up call, them calling me back and saying, I want to know more about this suggestion you gave me. I've never seen this kind of from my matey. Yesterday I had like a one-on-one discussion. I didn't ask for it. They came out, right? Which is very, very rare that we will see. After we discuss everything and we forget, we don't follow up. And I saw that happening. Maybe it's not happening everywhere, but it was surprising that I saw. a lot of maybe this is what is, because we go to so many conferences, be it international or here, but the amount of public participation, exhibitions. I didn't spend too much time in the exhibition, maybe a few hours, but there again I saw a lot of people wanting to discuss. It's not like, hey, I want to see this and move on, but every person who is coming in, we had a deep discussion. My team was also having deep discussion about it. It's not high level, just sort of move on, and I want to just so those kind of things was very, very important. So in terms of sort of how where I see this whole thing going is, I think we really saw examples of impactful healthcare application, and which can be sort of role models for others who want to follow. Of course, we called out the gaps and what people have to take care of if they want to build new AI models with impact and regulatory, clinical, and all aspects of it. And I think it's an exciting time for putting India on one of the top three, I guess, in three countries to build impactful AI applications to start with. Yeah.
Great. People carry the experiences, so that is a true believer. And, the substance is important, but the experience matters, and the Indian youth and all. And so I think that's good to know. And following up, so I think, thank you, Dr. Manjunath. Dr. Sujoy, what's your take on a real brief, because I think we are running short on time, so let's keep our answers real brief. Dr. Sujoy, what's your take?
Yes, I think one of the things that actually, I have 5 takeaways which stands out for during this India AI Impact Summit, was first of all what we did in terms of policy and strategy, what we call as the SAHI coming out, which actually puts in the strategy for AI in healthcare for India, which is in right direction. The BODH, or the BODH, which is about the benchmark open data platform for health AI. These are steps in the right direction. ABDM, which of course our Sharma sir had set up, looking at the interoperability standards. And if you're not with the interoperable standards for Indian perspectives, you are not there with your AI tool to come over. So those are steps in the right directions. Also trust frameworks, and what we see from a perspective of compute democratization. The other 2 aspects, I wanted to highlight that before this summit and our representation, and I spoke in the Elsevier panel, there were multiple meetings in IIT Delhi, and then of course in Lucknow from government of Uttar Pradesh. And I think one area that several state governments are doing in terms of taking technology, building capability from a policy standpoint, empowering people at the last mile, whether it is the ASHA worker and all that, and then challenging the innovators to actually make UI for AI, which would go into the transaction between those ASHA workers and the beneficiary at that level. And I think that is what is required in India as we go and democratize these tools for people at their last mile. And I think that's a very important aspect that I'm seeing. I would love to have a little bit more discussion around the compute, not only from a cloud perspective, but also people who are doing this on-prem, because purely from a security perspective, a lot of hospitals have problems with what we conventionally call as federated learning. Could be cost, could be privacy. That's again in one area that we could look at. Skilling, again, was a very, very important perspective. I was sharing it with the Deputy Director from the Department of Ministry of Health and Family Welfare. And he talked about how we are training our MBBS doctors with,
Right.
finally our MBBS doctors with, 30 hours of classes on AI and how they're going to use those tools. So those are going to become very, very important in future. And finally, the opportunity around collaboration, which you see across the world in that way. So I tick the boxes for capability, compute, then of course cognition, and finally on the collaboration. So all the 4 boxes were ticked for me during this India Summit.
Excellent. Great perspective. Thank you, Dr. Sujay. Love it. Shibu, what's your take?
Yeah.
Yes.
Yeah. So I see, I would say positioning, partnership, and investment with a roadmap to impact. So that's something. So when, as a small technology partner in India, we have actually built for global solutions, we walked out with a lot of excitement and responsibility. I'm just quoting responsibility. And confidence, right? Because we know that this is not only positioning and partnership announcements. There is a clearly investment declarations, and also there is foundation which is already be built in both in computing space and also forging partnerships. That's something which my takeaway. So, which also helped us in kind of forging partnership with the Indo region. So, for example, like we as a partner, largely working in the space of global health and mostly in African countries, we could bring in Africa CDC and have a conversation, facilitate a conversation between Government of India's public sector undertaking like a RailTel to actually how can it technologies to global south-to-south collaboration. So that's something, and which is very, very encouraging. And as Dr. Gita also mentioned, from a technology standpoint, there are follow-up conversations. Our follow-up conversations are mostly how can my country's scientists can learn from yours, and how we can co-create solutions for global health and impact in my country from technology transfer, knowledge sharing, joint investments. That's super encouraging for a startup like us, that we could play that facilitative role, and that is enabling and empowering for a startup like us. So that, I'll stop there as a 1-minute takeaway.
Yeah, great. Thank you, Shibu. Vivek, what did you see?
Yeah, so I had the opportunity to be in a few panels on the sidelines of the AI Summit. In fact, one along Dr. Geeta as well. In one of the panels, which had representatives from the government and health systems of multiple countries, what emerged is that India is at a sweet spot. Technology has taken a huge generational leap over the last couple of years, and India now has the intent, the talent, the tech prowess, and the ecosystem to build an advanced AI native digital health system that is completely interoperable without the baggage of having to migrate huge incumbent data and architecture into a new platform. India is starting fresh with all of its capability, which puts it at a sweet spot. And the digitalization of Indian healthcare data will be the biggest gold mine for healthcare worldwide, because the rate at which India can generate data, which is the fundamental for building good quality AI models, cannot be matched by any other country. There can be a few other countries in the world that can generate data at this rate, but in some of the multi-country interactions that we had, the trust that India has in the world ecosystem puts India at the forefront of the healthcare game. And beyond all of the demos in the summit, there were quite a lot in the healthcare AI space. What struck a chord is that India is raring to go and aggressive in this space, but yet very strategic in its approach. It is not haphazard AI solutions that are in silos that are going to be bolt-ons, but there is a clear vision, there is a clear central ecosystem around which the AI ecosystem of the country will be built. And the impact that I think India will bring to the world is in terms of bringing down the cost of care drastically and improving the screening abilities of healthcare worldwide.
Yeah, that's a good perspective. Thank you, Vivek. I totally agree on the amount of the amount of the data, but it has to be the quality data and the trained model on top of it. I think this is good. Let's go to our first segment now, which is the noise, right? And starting with the Commander Bali with you. So there's a great like AI ambition, right, which has been set, the youth and the startup and policy and all that thing. And then there is the ground realities of Indian hospital, right? That we are, facing data quality, clinician workflow, shortage of clinicians, skill, the IT, leadership, or the whether they understand, the healthcare tech or not, the governance and the human capital and the budget and all that thing. So my question to you, Commander Bali, is that where do you think that that's India AI conversation that we are seeing? Is it oversimplifying the healthcare ground realities of India's hospitals?
Yeah, so I think one of the most inefficient systems, I'm talking as a system, that exists both from the perspective of execution level and from the perspective of complexity, and where inefficiencies are at the peak, is the healthcare system. And I'm
Right.
now talking about the non-medical part of the healthcare system. I'm not venturing into the clinical part at all. So, I mean, centuries ago, the way we used to book appointments, come and wait in the OPDs, I mean, have fights over the bills, reports not generated, and all that, it exists still today, except for maybe a few, organizations. The second important thing is that you take a drive for about an hour from any one of the metro cities in the country and drive out 1 hour in any direction. The complete healthcare scenario changes. So you see those inefficiencies now being much more logarithmically increased. So this huge inefficiency which exists truly in the healthcare system was waiting for technology to catch up, truly speaking, to disrupt it. The disruptions that we saw in as mundane as film industry, and as important as aviation industry, and other industries, just did not seem to happen in healthcare at all. And I'm talking about these inefficiencies completely that exist in healthcare. What truly has changed, Vishnu, now is that AI seems to give us that ability to truly remove these inefficiencies. And I will, because we have shortage of time, and so maybe would not want one more question to come to me. There are many speakers. um, uh, we saw an opportunity 5 months back, and you were present and Dr. Sharma was present, when we had a competition amongst 5 top healthcare startups in IIT Indore. And the guy who came fifth was a company called HeyDoc.ai. But this youngster was very brilliant, and he spoke. He came up to me and said that we want to do something which can revolutionize and on a global scale. I said, you have. Let's go ahead and do it. All right. So, in 4 months' time, Vishnu, we launched on 1st January 2026. The global first, the world's first agentic healthcare chain was launched by ClearMedi Healthcare. You can Google it, along with this young guy from IIT Mandi and this startup called HeyDoc.ai. And because of this news, and it spread like whatever in those circuits where it actually matters, I was called to Paris. I went and represented India and the startup and what we had achieved on the G7 platform, because they were amazed at what we were doing. In just very brief, I just want to tell you, and as rightly said, a technology which does not help either the patient or the doctor or the system is of no use at all. Just imagine a farmer in Karnataka or in Leh Ladakh or in Nagaland or a remote village in Rajasthan, does not know even how to type, has a mobile phone, and he has a young kid or somebody who is suffering from a particular disease, and he learns about ClearMedi Healthcare. He just has to go and speak to the agents. He can ask which doctor can treat this, why is that doctor, what is the qualification, when can I see that doctor, how much time will I take for this treatment, is my Ayushman Bharat card acceptable or not acceptable, how do I travel to that place, where is that place, everything. And the answers are not, please hold on, we'll get back to you later, I'll connect with you, I'll put you on hold. No, the answers are coming like this. And this is, I don't think anything has actually disrupted, revolutionized, removed efficiencies from a very, very inefficient system than this. And as we speak, 2 days back, I mean, we first launched the type version, but then we went ahead and launched the voice module, all Indian languages. And now we want to add 6 or 7 languages like Swahili, French, Russian, we also want to give this opportunity to many patients who are coming from outside into the country using our agents. So you do not have to go through call centers, through wire medias, through anybody at all. It is direct one-to-one communication using agents, and these are outstandingly empathetic agentic systems which guide you, which are not like the bots that are very, very sort of offbeat and things like that. So to end my, that it has truly enabled, revolutionized, and removed inefficiency from healthcare system which existed from centuries. The effect of AI is not even, I think it's a tip of the iceberg, and something that we were waiting for many years. And I'm talking about just the non-clinical part. I can go on and on about the clinical part, but I don't want to take that time. So this is what we are witnessing right now, Vishnu. Thank you so much.
Yeah. No, I think to our esteemed speaker, Dr. Commander Bali, amazing, outstanding. I would love to catch up with you where else, on the progress side. A big round of applause for Dr. For the Commander Bali to be the first agentic AI hospital chain, and more than that, Dr. Sharma, you were there at our innovation challenge, and you just wanted to give it a perspective. We are really quick, to our audience. The DHN Innovation Challenge, essentially, the whole idea is to enable the innovators and transform and reimagine India's healthcare. And that's where Commander Bali met the head doc, and now it is actually now live at ClearMedi and bringing that patient and the business outcome that we all deserve. And Commander Bali, I think I loved your perspective in terms of the AI being that potential lever that can take India as a pole vault moment, the pole vault. So all the efficiencies, all that we have, potentially not all maybe, but a lot can be, addressed. So thank you for that. Dr. Sharma, to you. So as a father of ABDM, right, you have laid, one of the world's most ambitious digital public infrastructure, right? Now the AI ambition is accelerating a lot, right? Now, at the same time, now we have ABDM, and now we have, the readiness of ABDM. So what do you think, is this when it comes to the noise part of it, is there an expectation around AI is running kind of like ahead of what ABDM and hospitals are practically ready to support today? What's your take?
See, Vishnu, I think this is a very important question, and one has to understand the difference between the, customer-facing applications, the applications which actually provide better inclusion, better quality of care, better, more frugal kind of things to the people in general, and the ABDM architecture. So ABDM is built upon the basic principle of digital public infrastructure. And India has truly leapfrogged in the technology in the last 15 years, starting with 2009 from Aadhaar. And then, we had UPI, and now we have the ABDM, we have the Open Network for Digital Commerce, and a number of AgriStack and other kinds of things which are happening, whose basic principle is create a foundational kind of backbone, which actually, defines the basic principle of interoperability, federated data structure, privacy and security, open APIs, open standards, those kinds of scalability, speed. That is what ABDM is. ABDM actually creates a framework for this, the entire health systems. Now, what is happening is anybody can connect. As Vivek rightly pointed out, ABDM is some kind of framework where everybody can connect. So whether it is the customer-facing applications, and these applications are the ones which are going to actually accelerate the AI's application. So AI is going to be used as the cutting edge of these things, customer-facing. So whether a customer is communicating with his mobile phone in whatever his language or dialect is, and then mobile phone is then it is connecting to basic AI, LMLs, etc. That's one part, that's interaction. But at the same time, when it comes to digital data capture, digital data keeping, and then of course the other components of digital health services delivery, that is going to be done by ABDM. So in a way, both are going to supplement each other. It's not as if ABDM is going to replaced by AI or AI is going to replace that's not going to happen. What is going to happen is essentially ABDM provides that framework. And we will be surprised if you remember you had visited IIT Kanpur, and at that time we were talking of benchmarking open data health platform. In fact, we have developed that Bodhi, which was actually launched on 18th of February, I suppose, in the AI summit. So essentially, again, the same open data structure, and what Anish was saying about the open data, data.gov, and the kind of architectures. Our architectures are all open, and that actually very nicely fits into this concept of AI sort of being built upon, or AI drawing from this entire data stack. So that's something which is going to happen. So in my view, ABDM has come at a very right time, and so has AI at the very right time, and therefore I think both are going to complement, and it's going to become a combinatorial kind of explosion or exponential growth into both these areas.
Beautifully put, Dr. Sharma. Totally agree. Anish, coming to you on the noise side of the segment. So, like Dr. Sharma, you essentially are the enabler of healthcare data movement in the US, right? And I have seen you over the last 14, 15 years, and you have seen large-scale data, healthcare data, and big data initiative play out very well in the US. Now, in your opinion, in your experience, what one India advantage that you see? Where do you see, the India has a real great advantage, and one of the biggest risks that you see from the noise point of view that can potentially slow down the healthcare AI's, speed in India?
No, back to the architectural differences. I think building that consent at the ground level in ABDM, Dr. Sharma, I believe is a model that I want to bring back, and we're going to work on in the US. We don't have Aadhaar in the US, but we have embraced a version that runs through these identity management or verification platforms like Clear and ID.me. So we've got a private sector-led model to generate that effectively, that unique verification of who you say you are, but taking that architectural approach to honoring consent in the transaction, it is much more cleanly applied in the US model today. Whereas in the current record locator services in the US, we essentially have organizations asking almost in a broadcast way, does anybody have Vishnu's information? And if so, would you please respond? This is the challenge in the US, is that sometimes the congressional mandate blocking our ability to have an Aadhaar-like unique national identity creates these downstream challenges around how do we have data liquidity with honoring privacy. So I am taking back lessons on the ABDM architecture as we introduce products like ChatGPT for Health and Claude for healthcare, both of which came out of the US health tech ecosystem commitments that the large AI companies have made to basically encourage that as they roll out, we have more of that. I think you guys called it the consent manager, Dr. Sharma, that mechanism that allows for a more purposeful voice for the consumer in the transaction. To me, trust, you got to scale with trust. And if they can, we borrow from what works in India, it could be a quite useful thing for the US. But again, I see this as a bidirectional manner. It's also the case that a lot of the discrete data sharing in the US is maybe a little bit more advanced than perhaps some of the documents that are being shared in India. These are sort of scanned PDF files. And so there may be also a collaboration on the other side around how do we move towards discrete data, which could then inform language model improvements around predicting the next medical event, for example. So I came away, from this forum thinking that there's a lot more opportunity for more granular collaboration if we can find a way to it.
Awesome, beautiful.
just one thing which I wanted to tell Anis is that one of the principles which we have adopted in ABDM is what is called the federated data architecture, which means the data will remain where it is generated. So suppose it's Apollo Hospital, it will be in Apollo Hospital. What we have central is HIECM, Health Information Exchange cum Consent Manager, which essentially means that anybody, he fires a consent. Suppose I want to share data with my doctor, I fire, and then that it goes to consent manager, and it says, oh, this guy has got 7 records, 2 in Apollo Hospital, 3 in Clear Medi Healthcare, and 2 somewhere else, and it all fetches. It actually fires those consent tokens and their directions, and those data is made available to the device of the doctor to whom the person wants to share. So that architecture is actually an architecture which does not accumulate data. At the same time, it enables the patient to be in complete control of his or her own data. In fact, this can also happen that tomorrow, suppose there is somebody who says, I want data, and anybody is able to sell his data or actually provide the data at a cost, sure enough. So that's how it should enable. It should enable the patient to do that, not really asking somebody else saying that, oh, you give me Vishnu's data. No. That's how it is. Just wanted to make that clear.
A great document for us, Vishnu, as we do the sharing between the two countries.
Exactly. And just I want to leave this thought that I'm gonna set up another panel between you and Anish, and that we'll talk about that healthcare data. That's a different thing. All right. So Anish, you mentioned on the trust side. I think this is a very, very strong point. And Dr. Sujay, I want to bring you in here as a CMIU of one of the largest hospitals in India. And so there's a lot of noise around clinical AI, right? But the adoption is slow. So what and where exactly you see that breaks down? Is it clinician trust, medical legal risk, workflow integration, model missing validation? All of the above. Any quick checklist that you want to suggest for deploying clinical AI?
It's a great question, and I think all of the above. We did build a framework around this, which has now been taken over by the World Economic Forum, and to an extent suggested to WHO as well. So basically, it comes to what we call as, of course, from a systemic side, more around the interoperability, real-world evidence, and stuff like that. Whereas on the other side, you are actually looking at what is the need or the clinical need for which you have actually done this algorithm for. That's a very important perspective, and what my need is cannot be somebody else's need. So a lot of these models, as we go about in implementing, we see quite a good level of customization. And the other part of this is the explainability. And we always speak about not just the trust, but the pipeline of trust. How are these algorithms then giving you enough explainable components, which is going from the model to the physician and the physician to the patient. And that's where you create that pipeline going forward in doing this. I have another perspective, if you allow me 30 seconds.
Yes, sure.
We committed giving, a tech or committed giving AI to the world as much as 80 countries. And I know from India, we are doing this for several countries. Cure.ai stands out from anybody else. They're tallest in this field. However, there is a bit of a gap that I find from what our regulators should do with the other regulators to ensure that there is enough trust in Indian AI that we are building for healthcare. And what I mean is that, and there was a wonderful, a portion around that where India CDSCO, and Brazil's Anvisa signed a pact. If you closely watch the news with President Lula's visit, that happened. So how can we forge those kind of partnership from a regulator's perspective to build the trust on Indian clinical AI that we could go about in using it any part of the world, of course, with validation in that local population? That's a very, very important thing that we will still have to play if we are thinking of taking it to 80 countries or more than 80 countries in near future.
Excellent, excellent. Great perspective, Sujay. Thank you. Shivu, real fast. From the AI startup and innovator point of view, what noise and disconnect you see when you go and sell your software, your solution to hospitals, particularly in India? What do you think are the reasons behind those disconnects? And do you think any announcement, any policy changes from India AI Summit will bring some changes in next 3 to 6 months?
We have been actually WHO approved from 2021 onwards. Unfortunately, the government of India's uptake of this technology for scale-up has been pathetic. I should say that, use that word pathetic, because the procurement mechanisms are not defined for AI tools. So, though this has been seen as a product listed in all the Government of India platforms, the guidance to the states to utilize the government funds to procure AI tools being validated here, validated globally, and being done hundreds of evaluations, 200 publications, and also health technology assessment by ICMR, and clearly defined if you follow this pathway of AI pathway, there is a saving of 10,000 per tuberculosis case detected. So I'm just not exaggerating this Government of India's document. But when it comes to actually kind of get it deployed in government systems, there is a lot of conflict and clarity issues because it's not defined well. So I believe that probably this announcement to impact will also come up with a lot of policy changes in how do we get integrated with the existing health system and patient workflows in the government sector, in the public sector, because that's where the impact comes in maximum, because that's where the needy populations are mostly reaching. And that's where the requirement of an AI tool, because there is a dearth in human resource. We can actually optimize their existing, all the nice use cases we have defined and deployed in African countries are much more relevant and usable in Indian context. Unfortunately, the scale in Indian context is very limited, given the mammoth nature of the country. That is the one reason is the procurement guidelines thing. So I just stop there because that's something which is one single clear ask to the government is to change your policy to enable Indian technologies to be procured and deployed at massive scale.
Right. That's a very good point. And before I jump into this, segment 2, which is on the signal, like in terms of the opportunities that we are seeing, we are hitting our, 8:30 p.m. India time. 8 p.m. India time, 1 hour limit. I wanted to ask our esteemed speakers, if you have some time, I can go, but if we have hard stop, we can just wrap up in terms of like having your final take, and potentially we can do another round in March or in a smaller group. So I want to take because I want to be respectful of everyone's time. It's a Friday evening.
I will drop off in a minute or so.
Okay, Anish, how you are doing? Do you have a few minutes?
We can wrap up. Yeah.
So you have a few minutes?
I think few minutes is fine, but then we probably will have to do justice with this thing. I think another round on some of these issues will be very, very helpful.
Yeah, because
but it's few minutes is fine.
Okay. I think so. In the interest of time, and I know it's a very important topic, and the segments are important. So we'll schedule the follow up segment. But before we wrap up, I think what closing round in terms of like what key takeaway that you would like to talk about after all you have heard, noise, signal, opportunities, and I think and I would agree that most of our speakers, you in somehow or other you touched upon the opportunities and the challenges and what's on the horizon. So I think we are good. But so if we are doing this town hall in next year, Fab 2027, what would success actually look like from the AI in Indian healthcare, and what would tell us that something has gone wrong. So we are doing this town hall 1 year from now. How the success looks like? Dr. Sharma, brief.
I think that's a very interesting question. Of course, I'm not an astrologer to really tell you as to what is going to happen in February of 2027. But I would say the actual my wish list, if you see, is that what Dr. Bali mentioned about the inefficiency in the entire sector. It is true. But if that can actually somehow be eliminated or at least reduced to a very significant extent, and healthcare services become accessible, affordable, and become of a better quality, it will be a great success. And I feel that this is possible because India, what is happening is, it is not as if people don't adopt to technology. People have adopted to technology in the past. They are using technology in almost all walks of their life. We today have 1.15 billion mobile connections. We have 800 million internet connections. We have the cheapest data rate in the world. We have all kinds of smartphone population is growing at the rate of 20 million per quarter. So I mean these things are the digital part is quite acceptable, and it actually gets this thing. So I am very hopeful, provided these technologies also start at the consumer and the patient, and they become ubiquitous, and they become, of course, India is a country of low value, large volumes. So therefore, deployment of these technologies has got to be frugal. It cannot be that patients cannot pay that I'll charge 100 rupees for connecting to that AI system. You have to have, but then I must say that frugal will work in India, because when I was working as a regulator in telecom sector, people used to ask me how much is the ARPU. The average revenue per user is what is ARPU, and I said it is $2. And they said, oh, $2, how can you survive in $2? Because in Sweden or in America also, the ARPU is $50, $150. And I said, boss, what is your population of Sweden? 10 million. 10 million multiplied by 150 is how much? And applied your $2 to 1.2 billion, it is 2.4 billion. So therefore, in India, because the scale and numbers are so large, therefore the technologies will not only be, it is possible to have a very frugal kind of technologies which can help large number of people. And that's what I would expect, that more and more people adopt to these things. More and more innovations come, more and more sort of people who kind of come up with these technologies are able to deploy that. And of course, to Dr. Shibu's point of evaluating and purchasing and procurement of the AI technologies, that's one part. Certainly it's important, but I think more importantly, it will be the people facing sort of systems which do not probably require the government to become the procurer, but actually to do it on a model which does not require government's intervention. Because governments, as you know, they pretty it's very difficult to actually difficult also. Not only you have the three C's, as I call it: CAG, CVC, CBI, and we all have to guard against those things that tomorrow, after 10 years, somebody will say, oh, why did RS Sharma procure these technologies? These technologies are available at free of cost, and why did he pay so much of money? So therefore it's difficult, friend. If you were in the position of a government and you were afraid of these three things, it's very difficult to evaluate something which is not so concrete in a way, not so established, which is something which is developing. And therefore, I think the best way to permeate into that system is through the route of the citizen-facing applications and citizen-facing systems. Anyway,
Beautiful.
thanks very much.
Beautiful. No, thanks for clarifying, Dr. Sharma. I think that's great perspective. Anish, we are doing this town hall next year. How success looks like, and what could potentially go wrong?
Well, I think the more important thing are the applications to help the individuals. I think Nandan said this on many panels, that the PM has directed that this be done to have actual impact on individual people. So we want to have examples of individuals having second opinions, better diagnosis earlier in their status, better treatment plans. And so those, while the enabling ingredients and the market ecosystem is important, having the actual case studies of production benefits will be critical. And I am looking forward to more cross-border collaboration in that regard.
Great, wonderful. Commander Bali?
Yeah, so in addition to removing the inefficiencies that I spoke about, 1 year from now, I think three applications where I'm sure we will be talking about. One will be the radio diagnostics and use of AI in better radiology solutions. The second would be oncology and preventive oncology. I see certainly after in 1 year's time, you'll see huge amount of AI, usage and to do that. And third, very importantly, Vishnu, would be reduction of mortality in hospitals, in ICUs, and critical care areas using AI. So I'm
Perfect.
sure one I spoke about, the startups like Doc AI, and many more of them doing pretty well. But I think these three more of the what I mentioned in clinical space, we are likely to see huge amount of work being done. Thank you.
Wonderful, wonderful, wonderful. Dr. Manjunath, I know you have to leave. Real brief, 30 seconds or 45.
Sure. So I think I agree with all the three panelists who spoke about it. But two things stand out. One is I think in the startup ecosystem, there should be clear responsibility to build responsible AI, particularly clinically validated. On the other side, a procurement side, be it government or the hospital, I think some kind of governance body to make sure what they use is really well tested in prospective blinded studies is very, very important. And I would like to see this. I mean, this is basically the challenge as well as, something we really have to work on. Outcome wise, I would say two things we have to measure for. One is how many such AI models really developed in India, make in India, got adopted, in how many deployments in India. And second thing is how many people actually benefited. I think one of the previous panelists mentioned about it, like case studies and sort of, can we say at least 1 million users benefited from this? And is there
Correct.
some way of documenting it? And that's the strength of moving forward. Yeah.
That's beautiful. I totally agree. I think that's very important, that measuring the success of AI outcome, how it is making the differences. I think this is good. If we have Dr. Sujoy with us, Dr. Sujoy, if you are there, your take, final success, how it looks like. He might have dropped. Anyway, Vivek, how the success looks like to you and what potentially can go wrong real fast. And
I feel if 1 year later we had the same panel, we would have moved past the noise, which is discussing art of possibility with AI. And we would have actually be discussing one generation behind, which is how to get hospitals to actually build data foundations properly so
Yes.
that they can reap the benefits of AI in a deeper manner than bolt on small AI solutions that present quick wins and will eventually be a commodity. So I think that journey is very critical in terms of a solid data foundation. The gap is going to be huge with hospitals that have invested in a strong data foundation and hospitals that haven't. That is going to be apparent in 1 year. And that is the large scale problem we'll be looking to solve from an Indian context.
Totally agree. Dr. Shibu, what's your take?
Yeah, so we have 150,000 Ayushman Bharat Mandirs, and these are where actually upskilling is required to reach the population impact. And we do have the right tools now, which is AI enabled. I would say 80% of them need to be AI enabled to help the community at the last mile. So that is the single most thing which I propose, like when we meet maybe after 1 year, that is things. So on the upstream side of like, let's say we have 780 plus district hospitals wherein actually the efficiency part of the processes could be improved. I'm not even talking about, as Dr. Commander Bali mentioned, about the clinical workflows. The need of clinical workflows optimization is more in the downstream Ayushman Bharat Mandirs, where actually low skill staff is managing. We can upskill them to and improve the quality of delivery. On the upstream side, the bigger hospitals, the district hospitals, we can actually do process optimization by bringing in AI. So at least 50% of them need to be empowered with AI, at least, and 80% of the downstream facilities need to be empowered with AI. Thank you.
Excellent, excellent. And I think I want to summarize, and I want to thank all of you, particularly Anish, you joining in the morning, and and Dr. Kuma, Commander Bali, Dr. Geeta, Dr. Shibu, and Vivek. I often say this, that healthcare transformation is not limited by technology. We have abundance of technology, and particularly within India, we are second to none. It is limited by execution, adoption, and scale, and that is true with the AI. And I think, Commander Mali, you mentioned early on that, the efficiencies can be minimized. And I think that's something very important. And, we look forward to it. So thank you so much from bottom of my heart. I appreciate your time and presence and insightful perspective. And let's build this moment together and, share the learning. And Anish, particularly with you, would look forward to learning and taking this, your guidance to apply that some of the use cases in India and vice versa. So thank you so much. Recording will be available, and look forward to our next town hall. Thank you. Take care.
Thank you so much. Have a good day. Bye-bye.
You too.
Bye-bye.